Okay, so next I talk about other biomedical therapies, right? So you've got electroconvulsive therapy or ECT, right? Electroconvulsive therapy, where you basically send an electrical signal into the brain. You zap the brain, right? Is what you do. Um, now, in the past, right, when this was used, like earlier 20th century, right, 30s, 40s, maybe 50s. Uh, you might see some old movies. If you ever see that old movie One Flew Over the Cuckoo's Nest, you see the use of ECT in that is yeah, it seems, yeah, it wasn't as well regulated. Nowadays, electroconvulsive therapy, because it can make the patient convulse and pull muscles and hurt themselves. Nowadays, you give them muscle relaxants and stuff like that. You closely monitor what's going on in the brain, and you also uh, give them the minimum amount of electrical shock you can, and you can even just do ECT to just one hemisphere of the brain, one side of the brain, not the whole brain nowadays. So it's supposed to be much more humane in the way they use it today. It can still be used for a variety of things, but I think primarily it's probably fair to say that it's used to as a last resort in drug-resistant major depression, right? To bring somebody out of major depression. I said drug resistant, so they've tried the medications, tried all the medications, different dosages, nothing has worked, right? Then you might resort to electroconvulsive therapy. And you might use it in some other cases too. They mentioned there in the book. But the idea is that it's done in a much better way today, you would hope, right? Um, so anyway, that's ECT. Um, and a lot of these therapies developed um, because, well, in the earlier 20th century, well, ECT did, and also the prefrontal lobotomy, because there were no other options at that time. There were no drugs to treat people at that time. So medical professionals were looking at these different things, right? But still, sometimes today, you need that electroconvulsive therapy. Then they mentioned some alternative therapies that there's still research on these being done. Some of them are controversial. They mention that repetitive transcranial magnetic stimulation, that RTMS, oftentimes just called TMS. So magnetic stimulation of the brain. That's still somewhat controversial, but I believe it is approved by the FDA in the treatment of some things now. Then they've got direct brain stimulation. They're doing research on that stuff nowadays. Well, I guess they call it deep brain stimulation in the book. But you actually plant electrodes in a particular area of the brain and stimulate that particular structure in the brain, just one small part of the brain. So I was researching that now, and they're doing some of that with depression. I'm sure they're doing it with other disorders too, where the medications don't help, but we can implant these electrodes in particular places in the brain. When you stimulate them, the person just feels happy. They're just not depressed anymore. And so there's some talk that you might get these someday, as the way you have a pacemaker you can implant in an individual who has problems with their heart. Maybe you'll be able to implant these electrodes and once again plant the battery or whatever under the skin someplace, and it can be sort of a depression pacemaker or to get rid of depression, right? But there's still experimentation on that, and I think they are doing clinical trials and that sort of stuff. So who knows what we'll find in the future for that. But then they do mention psychosurgery. This would be today psychosurgery, surgery on the brain to deal with some psychological disorder. This is a very, very last resort. Hopefully obvious to you, because once you do surgery on the brain, once you cut something out, it's out. You can't change that, right? So back in the day, like I said, the prefrontal lobotomy was used, and it was actually a Portuguese neurologist that discovered this procedure. and he won the Nobel Prize in physiology and medicine for it. Uh, you had patients that were acting out, right, in mental institutions that were hard to control and manage, and they could hurt themselves and others. So there were no drugs at that. This we're talking about the first half of the 20th century, right? That there were just no medications to give them to help them. So so yeah, your option was putting them in a straitjacket all the time or tying them down to a bed all the time. That's all you could do. That's it. There are no other options. So this is a very simple surgical procedure. It can be done very quickly, right? And it made the people more manageable. It sort of deadened their emotions, made them less likely to lash out at others, but of course, unfortunately, it made them more remote and less emotional overall. And it is surgery on the brain, so sometimes sometimes patients could die. You could have a blood hemorrhage or something. If you hit the wrong structure. So it was dangerous. And they do mention in the book that one of the Kennedy sisters, had a prefrontal lobotomy. She had some mental health issues, and her father, Joe Kennedy, right, the father of John F. Kennedy, had a prefrontal lobotomy done on her, and it went wrong. And, well, she just lived in institutions the rest of her life. But you do have to remember there were no drug therapies at that time. So this was seen as the last desperate hope for people. So that's why it was chosen back then. Pardon me. It still can rarely be used today, right? The lobotomy. You'd have to ask someone more smarter and more qualified than me as to exactly why you'd still use that nowadays. Maybe just in very extreme cases. So you have to be very careful. So psychosurgery would be an absolutely last resort from our perspective nowadays, right? And then I'll let you read probably the rest of the chapter. I mean, they mentioned some other important things. They mentioned post-traumatic growth, that resilience is important. Want to encourage resilience and healthy lifestyles in individuals to help sort of prevent mental disorders from occurring. But we do focus on post-traumatic stress disorder. We mentioned PTSD, obviously, in Chapter 15. But that's a minority of people. Other people who go through trauma can grow from that trauma. And so they do mention that phenomenon here, post-traumatic growth, right? But anyway, I guess that's about it for Chapter 16. We've got the test tomorrow. I posted some practice questions for 15 and 16. So study away, and hopefully we'll get everybody passing this class, right? All right. Good luck.